This is The Broken Shift with Nurse Natalie. Healthcare doesn't break in chaos, it breaks quietly. Most people think healthcare is about doctors, nurses, and hospitals. But what if I told you healthcare is becoming a data system first and a care system second? When you're in a hospital, you expect your most private information to be safe. You put your trust in the nurses and doctors. But what if that trust is being broken without anyone telling you? What if a controversial tech company, one with deep ties to the military and immigration enforcement, is operating inside that very hospital, using your personal health records to train its AI? And what if the people sounding the alarm aren't investigators, but the nurses themselves, who are realizing this system isn't just making things run smoother? It's about control. Today, we're looking at a hidden reality unfolding in hospitals. This is the story of how your medical data is being used by a surveillance-linked machine, the impossible choices it creates for healthcare workers, and what it all means for your privacy. See, on the surface, it all starts with a promise: a smarter, faster, more efficient healthcare system. It always starts with a promise. Hospitals are adopting powerful AI and data analytics platforms to streamline everything from patient scheduling to managing supplies. And tech firms like Palantir, famous for its work with defense and intelligence agencies, have moved into healthcare, offering software to make sense of the mountains of data hospitals produce. The sales pitch is powerful. By mixing clinical, financial, and operational data, these AI systems can predict staffing needs, cut patient wait times, and optimize operating rooms. HCA Healthcare, one of the country's largest hospital systems, uses Palantir software, as do Tampa General Hospital and Mount Sinai in New York. For example, Tampa General has used it to reduce the time it takes to place patients by 83% and cut patient hold times in recovery rooms by 28%. The stated goal is to ease the burden on caregivers and improve patient outcomes. It's a vision where tech helps doctors and nurses do their jobs better. But what happens when that same company uses its tech for a very different client with a very different goal? This is where the picture gets dark. The same company that promises to optimize hospital beds, Palantir, also has billion-dollar contracts with the Department of Defense and has worked with U.S. Immigration and Customs Enforcement, or ICE. Investigations have revealed a specific Palantir tool used by ICE called ELITE, which stands for Enhanced Leads Identification and Targeting for Enforcement. This isn't just a database. According to reports, ELITE is an app that creates a map of potential deportation targets, providing agents with a dossier on each person, including their name, photo, and even a confidence score on where they might be. And where does some of this data come from? According to reports, based on sworn testimony and internal materials, the ELITE system pulls in data from the Department of Health and Human Services. A data sharing agreement allows ICE to get information from CMS, the agency that oversees Medicaid. While Judge While a judge placed some limits on what can be shared for certain states, this has blurred the line between public health and immigration enforcement. It means that data like names and addresses provided for services like emergency Medicaid can become leads for ICE. This isn't a hypothetical risk. It's the reality of a system that treats public health data as a source for immigration enforcement. This dual use of data creates an impossible ethical crisis for people on the front lines, nurses. In the nursing community, we've created here a concept called the broken shift that has emerged to describe the moral conflicts nurses face daily. They are trained to document patient information thoroughly for good medical care, but they are increasingly fearful that the data they enter into an electronic health record could be used to harm that patient. Imagine a nurse treating an undocumented immigrant. To do their job right, they need to document things like the patient's primary language. They might need a translator. But if the nurse knows that the hospital uses a data platform from a company that also works with ICE, that simple data point no longer feels like it's just about patient care. It feels like a potential flag that could be used for profiling. As a nurse, our job is not to be involved in profiling our patients. And this fear has led some nurses to change how they document, sometimes leaving out details they worry could be weaponized. It's a quiet act of protection that goes against their professional duties and strikes at the heart of medical ethics. This dilemma erodes patient trust, especially since most are unaware their data is being shared with third-party business associates like Palantir. Recent surveys show just how deep this mistrust runs. One found that only 22% of nurses trust AI tools to support safe patient care. Another survey by National Nurses United revealed that 60% of nurses don't trust their employer to implement AI with patient safety as the first priority. Imagine you have a patient that comes in and they're asking you, please don't document. They're yelling la migra, right? So when somebody says that to you, it's kind of a heart stopper, because when you ask someone what country they're from or what language they speak, it's because you want to help them. But when somebody responds with la migra, that means that they are scared that their information is going to be used against them. And the care that they need, they won't be able to get it. And healthcare is supposed to be one of those places where patients can go and not be targeted. Let me know if you think transparency in healthcare is a conversation worth having. Take a second to subscribe, because we're committed to telling these stories, and your support makes it possible. It's not just patient data. The surveillance isn't just aimed at patients. It's also being turned on hospital staff. Many nurses are now required to wear badges with real-time location systems, or RTLS. These systems are often pitched as a safety feature, a panic button nurses can press if they're in danger, which is a serious concern. But these badges often have a second function. They track a nurse's every move. This location data can be fed into the same analytical platforms, crunching patient data with the stated purpose of optimizing workflows and efficiency. But many nurses see it as covert surveillance and a tool for control, managed by algorithms they can't see or question. Decisions about staffing levels or even a nurse's performance can be influenced by this data, often without their input. One survey found that 40% of nurses feel they have no meaningful say in how AI tools are chosen or used in their workplace. This level of tracking is often applied just to nurses, not doctors, which suggests a fundamental lack of trust. It shifts the focus from compassionate care to pure metrics, turning dedicated caregivers into data points to be optimized. I read a story recently about how they're using nurses, remote nurses, to track what's happening on the floor, supposedly to help the floor nurses determine like if there's something going on, if there's a patient that's going to fall. So they have like some type of tracking system. But what's happening is that this system now is being used to track nurses for different reasons. The same systems that are supposed to come in and help end up being the same systems that work against you. And some of you out there might be wondering, like, how is this legal? The answer is in the fine print of our health privacy laws. The Health Insurance Portability and Accountability Act, or HIPAA, is supposed to protect your health information, right? But HIPAA has a major exception that allows hospitals to share patient data with third-party business associates without explicit patient consent, as long as it's for healthcare operations. This is the loophole that allows powerful data companies into the hospital, optimizing workflows and managing staff are considered operations. So even though a hospital has a contract with a vendor like Palantir, it doesn't change that your data is being shared. The problem is that the definition of operations is broad, and technology is evolving much faster than the rules. While some data sharing is necessary, like for tracking infectious disease, civil liberties groups are fighting the weaponization of general health data. And that's the thing. They're using this data and they're weaponizing it against the patient. The Electronic Frontier Foundation, for instance, has filed legal briefs asking judges to block the government from using data like Medicaid records for immigration enforcement. After demands from activists, one of New York City's public hospital systems announced in March of 2026 that it would not be renewing its contract with Palantir when it expires. Listen, what we're seeing is a quiet merger of public health and surveillance. It starts with the promise of efficiency, but can quickly become a system of control, creating massive ethical problems for caregivers and putting vulnerable patients at risk. Your data, given in a moment of trust, is being used to train algorithms for purposes you never agreed to, by companies with deep ties to military and law enforcement. Nurses are stuck in the middle, forced to weigh their duty to document against their instinct to protect patients from a system they don't trust. This isn't a problem of a few bad actors. It's a systemic issue born from legal loopholes, a lack of transparency, and the unchecked growth of surveillance tech. And most people don't even know this loophole exists. The most powerful tool we have is awareness. Share this video. The more people who understand what's happening inside our hospitals, the greater the pressure for change will be. Ask your local hospitals, who are your data partners? What companies can access patient records? And support organizations that are fighting for digital privacy and patient rights. Every patient has a right to medical care without being hunted. And I want to leave you with this question for the comments. Where do you draw the line between using data for efficiency and using it for surveillance? Your voice matters. This is the part nobody talks about. But we do here on the broken shift. We don't need AI to replace people. We just need enough data to understand them. This is the broken shift. Healthcare culture doesn't change when we ignore it. It changes when we're willing to examine it. This is the broken shift.